I'm Brittany Lewis with Forbes Breaking News. The House Oversight Committee held a hearing Monday on the federal response to the opioid crisis. More than 107,000 Americans died from drug overdoses in 2021, which is a record high. According to provisional data from the CDC, opioids accounted for more than 70% of the fatalities. During the hearing, Representative Rashida Tlaib asked about the availability of Narcan. Listen in for the response from the director of the White House Office of National Drug Control Policy.
I know addiction is a critical issue. Even as my colleagues focus so much on some of the border and immigration policies, I know within our own country, we just have not done enough to push back and understanding or push back on this rhetoric that we don't have a substance abuse issue and problem in our country, especially with even some, legal pharmaceutical companies pushing, the opioid, contributing to the opioid crisis right here at home. And many of my colleagues continue to actually benefit through political contributions from some of the same folks that continue to push those drugs onto our families. One of the things I want to talk about is that expanding access to an opiate overdose reversal medication, as the Narcan, would help achieve so much in saving tens and thousands of lives, as doctor. And we've seen in places like I think Massachusetts, and where Narcan distribution program reduced opioid overdoses and deaths by an estimated 11% without increasing opioid use. If I may, Chairwoman, I'd like to submit for the record a study to show some of the impact of that program, that distribution program.
Without objection.
Thank you. To maximize the life-saving potential of these treatments, it is imperative, as you know, doctor, that the overdose reversal medication are affordable and easily accessible in every city and town across the United States. Director, how does the current administration's national drug control strategy increase access to Narcan so it can be readily available for people who need it the most, including those historically neglected communities like mine? I mean, you should know this, seeing some of the information coming out. I think the past decade, over 2,000 of my fellow Detroiters lost their lives to this corporate, many corporate funded pushed, addiction on them. Of them, 364 were overdose deaths in 2019. 86% of those deaths were involved opiate. And so what can you tell me that you all are doing to increase access?
Thank you, Congressman. Naloxone or Narcan, this is about making sure it's affordable and it's accessible. And one of the things we're doing is making sure that states have a set aside amounts to be able to both acquire as well as have a distribution plan to especially the most vulnerable communities within the states to be able to distribute. It does no good sitting on a shelf because it expires. It's not saving lives. But we are very intentional about making sure that we are removing the affordability aspect of naloxone, and we are providing naloxone in the hands of people who need it, because we know that if we do not, we are on track to have 163,000 deaths a year by 2025. But if we do what the strategy calls for, we can reduce that number literally by half to 81,000. If we accumulate over the next 3 years, we're talking about hundreds of thousands of American lives that could be saved. And naloxone is life-saving. For every dollar, there's a $2,760 return on investment. It is the biggest bang for the buck in terms of saving lives, and it is a critical aspect of the strategy. So we're moving forward to make sure that we're working closely with HHS, with our other federal agencies and state partners, as well as local partners.
Well, thank you so much. One of the things as a parent I want to talk about is how do we have it accessible in some of our high school and universities and campus, because I've been hearing obviously an increase in addiction among our college age, I would say, and youth. And so anything that we're doing in that regards.
Thank you, Congresswoman. It breaks my heart every time we see children especially die unknowingly, unsuspectedly, because of they've used a counterfeit pill. It's important while we work on the supply side, we also make sure our kids are aware. This is no different than learning CPR, than having AED device in the wall. And so it's going to be very important for us to make sure we're removing the stigma out of this and getting people to understand this is about saving a life, not making judgments, because we believe every life is precious and it's worth saving.
Absolutely. And, again, as I look at our country, if it's not this crisis of addiction, there's others in the future. So we really have to try to work on this holistically as well. So thank you all so much. And I yield, Madam Chair.
Thank you. Before we close, I want to offer the ranking member an opportunity to